Hello, everybody. Welcome to South First. I am Chetna Belgare, editor health for South First, and joined by my colleague Sumit Jha, who reports on health as well. Welcome, Sumit. This is Inside View, where we discuss, the stories that we have dealt with, the ground reports that we have done. We talk about what went behind the reporting of this particular story. And today, here we're discussing something very, very important and something that has made news and something that has kind of caused chaos for a few days in all our lives, probably. This is the hMPV virus. So, Sumit, first of all, how's the reporting pressure treating you?
Oh, thanks for having me here. It's not like COVID. I'll just say that because right now, like while reporting about hMPV, I have a better idea that what should I look for. Not like COVID that we didn't have any idea that where to go and what to report
Right.
about. We were just flowing with the news coming up. But now we are much aware about the situation. So we go back and check the stuffs which are coming to us, cross check with the experts, cross check with the scientists about the virus, and as well as also look for the data and how to collate the data in a way that we can report correctly, not like for the just for sake of reporting it, but for giving the right information to the public. That is what right now I'm mostly focusing on.
I'm really glad that, at South First, we have always been very, very cautious. I think I remember the conversation we had the first day when the news broke. I saw on some of the, regional channels that, lockdown again, question mark, question mark. Then, Chini virus in India
Yeah.
and, several such headlines, screaming headlines. And I was like, oh my God, not again. So, like you said, I'm really glad that, most of us as health reporters as well, probably when COVID struck, we were also caught unaware. We didn't know what we were doing. And then it took us some time to kind of understand. But I'm really glad that at South First, we have made sure that we have got only authentic news and also cross-checked with several experts before we put out our story there. So, Sumit, you have also done, several stories. You've even looked at the numbers in China and what is that, which way virus is actually circulating there, and things like that. So, before we head to all of those things, maybe I should just give a bit of information about what exactly is hMPV for those who probably don't know or not have followed this news. I think it is basically hMPV is human metapneumovirus, which is also known as hMPV, and it affects usually children who are less than 2 years or 5 years of age, and also immunocompromised people, like any other respiratory infection. Also elderly, it can kind of cause a little more havoc. I think, Sumit, if you on a lighter note, if you saw that video which went viral where this virus itself is talking, I think it was a very good video of the virus explaining that it is not really as lethal or as dangerous as COVID-19, and it can be detected, and it is self-limiting in most of the cases. Of course, in some cases like immunocompromised people, they might have to take more precautions because it can turn into pneumonia. And the symptoms, as usual, why probably it is kind of overlapping with like any other RSVs. I think the symptoms are very similar. Like you have cough, cold, fever, breathlessness in some cases, and it's also kind of dehydrating and things like that. So causes dehydration as well in some cases. So I think these symptoms overlap with many other influenza kind of symptoms, right? So I think that is one confusion. So Sumit, what did you find? This is basically the brief of what hMPV is.
Yeah.
If I have missed out on anything, please continue, Sumit. You can just add
So I
to it.
just want to add one thing that it is seasonal. It comes during like
Yes.
as
Yes.
WHO stated
Very
that it
important.
is during comes during winter, and also like starting of the spring season also it remains there, but it is very seasonal. It's not all season disease like COVID-19. Yeah, that's
Yeah,
just
and one more thing I remember is it does not need a travel history. You don't
yes.
have to travel to
Yes.
China or Bangkok or any of those places to actually catch hMPV, because hMPV is there. It is not a
Yeah.
new virus. It has been there for 2 decades now. It
Yeah.
was first detected in Netherlands in 2001, and even in India it has been there. We have not tested so far. So, but let's discuss about why this became so much of a concern. If you can just throw some light on what really caused this panic. I know that there were several such, I think from last few months before, there was some video which came out of China, and where again the same
Yeah.
scenario where there were hospitalizations, and was it a COVID fourth wave, fifth wave. So there were a lot of discussions around that, but then it died down. It did not take this kind of a fear situation. So what is it that is actually causing this fear now?
So this time what happened that there were two, three videos, not many videos, only two, three videos which started to circulate on X, like previously Twitter. And these getting circulated on X by the verified handles. Now Twitter has started to give blue check to everyone. Uh, these handles were the one of the handles which were quite prominent during COVID-19. They were giving right information during the COVID-19 about the cases across the world. And that handle has shared those videos. And the is uh, along with those two videos, there were two keywords. The one keyword was outbreak in China, and another keyword was emergency declared in China. So what happened after that? That first week of January, around 1st or 2nd January, uh, the video which was circulating on X, it was picked by the web desk of one of the leading media houses with the keyword there is outbreak like situation, COVID like outbreak in China with question mark, and it was shared on Instagram. It went viral there, and from the same Twitter feed, uh, another news outlet which is quite prominent, which is in that is. Like one of the best news sources in India, they picked this news and said that emergency has been declared in China. And they also put a question mark, not confirming that, okay, there is this has been confirmed. After that, it started to circulate all over the internet. Everyone has the news that, okay, there is a new virus in China and it is called hMPV virus. It is going to cause another havoc in a healthcare system. But the good part was that on January 3rd, yeah, that day we first discussed about what is this virus. The same evening, Director General of Health Services, Dr. Atul Goyal, he came on record and that day he clarified that this virus, hMPV virus, is not a new virus. It's like any other respiratory virus that causes common cold, and uh, it just have flu-like symptoms. It was cleared on third, but again,
I think that was I think by then the fear had spread
this,
everywhere. There was panic, and there were people talking about. I mean, I got a lot of calls. Being the
yes,
health reporter, I think I'm sure you have also like
yeah,
received a lot of calls from your friends and family asking, will there be a lockdown? Will
yeah,
there
yeah,
be, what do we do now? Should we wear masks and all of such things? And I think some state governments were proactive. They did come and say. What
yes,
surprised me was, when they said that Bangalore hMPV
yes,
hMPV's
yes,
first case detected in Bangalore in a 8-year-old and then a 3-year-old. So there were two cases coming from Karnataka. And me being from Karnataka, it was more pressure on me to kind of, tell them that this is. I mean, I saw on X there were, scientists like Vinod Skaria and all. They were saying that why is it that the ICMR is also talking about identifying this virus which is already prevalent. But I feel that somewhere, I think it is good to identify this, though it is like one celebrity in a celebrity that has not been noticed until
yeah,
now.
yeah, yeah.
The it's like in the RSV family, but it's not really been noticed.
Eh,
And Sumit, if you can tell me one more thing about why it becomes important to actually trace this from a point of view of, the mutation and things like that. So if you can explain to that on that. You
Okay.
basically, maybe before that, what we could talk about is, you wrote, today it's got published, sorry, yesterday it's got published about, what is the actual situation in China? What is it that is actually causing the increase in number of cases? Which means that the videos which you are seeing is may not be
Yeah, yeah.
completely false as well. So what is it that what did you find?
So, China CDC, China Center of Disease Control, has put out some numbers about the respiratory outbreak in week 52, that is from 23rd December to uh, 29 December. When we started to hear about the cases has increased, the hospital has been overwhelmed by the hMPV cases. But the numbers of week 52 shows that only 6.2% cases were of hMPV, and that was just an increase of 0.1% from the previous week. And in hospitalization, only 5.4 percent cases were of hMPV. Most of the cases were of influenza virus. The influenza virus were detected around 30%. That is like 5 times more than the hMPV virus. And similarly, hospitalization was 3 times more than the hMPV virus in influenza case. This was the number put it by the China CDC. They are not saying that, okay, hMPV cases are not there. They are saying that it is there, but like the way it has been reported, the numbers are not showing like that. The another point which was there, that emergency has been declared. China CDC through WHO said that. WHO also put out a statement yesterday saying that China has not declared emergency. This is just a seasonal northern hemisphere virus which has been causing influenza-like symptoms, and there is no need. They have not used the word "no need to worry," but they have said that, okay, we are keeping track of it. This is what is the
It's a
situation.
monitor. Yeah.
Yeah.
Mhm. Okay.
Now
And
the
I think, what I when I yeah, tell me. You can
I
add.
was
Yeah.
coming to the mutation part here. So, like as you have spoken to many experts, I also spoke to few of the experts, and they all were telling only one element, that this virus is not causing any, has not caused any distress in past. The only issue which can come up with this is that if there will be any mutation that can lead to more mutation, if there is any mutation which is causing more disease, more infection, that can be harmful for the community. That was one of the
So there is a reason, Sumit, I just want to add to whatever you're saying here, that, actually when COVID-19 happened, see, basically COVID-19 is a coronavirus, and
yeah,
that has been there for a long time.
since
But what have
2009
that
it was
SARS,
there.
MERS,
Yeah.
and COVID-19, all three were there, but then
Yeah.
COVID-19 turned lethal. So
Yeah.
COVID-19 was more lethal, it was more transmissible. China did not give us information at the right
Yes.
time, so it spread like wildfire, and it's a fire, and it caused a lot of havoc, and it was mutating. So that is the reason why, I think it becomes very, very important. Even, when I was talking to several experts, that's where they were saying that right now it is nothing to worry about. Only thing that we need to be probably very, very constantly keeping note of is whether it is mutating, whether it is something which
Mm.
is, which can, increase in its transmissibility, which can increase in being lethal and things like that. Because these RSVs are known to mutate. I mean,
Yes.
they are very notorious for that.
Mhm.
So that is something which really needs to be taken note of, and I think ICMR is doing that. And I think our,
Mm.
we do, we have probably learned that lesson, that we need to keep tracking it. But only thing is, I've also heard, Sumit, that though this can be detected in RT-PCR, we need a genetic material that it can actually detect this particular thing. Did you find out from experts whether it is whether it is necessary to actually go and test for this particular virus? Because some of the people are asking me, like, when you have a cold and cough and all, like we did for COVID-19, is it
Mm.
important to go and test for this? What some of the states have spoken about it. What is, did you find out anything on that?
So, like in past, there was like when you get cough and cold, you usually don't used to get test, and people just go to the medical shop and buy. Now the thing is that if even the doctors are now practicing that if there are multiple cases of cough and cold, they ask the patient to go get tested. And many of the lab do these swab testing, and they keep the samples with them, and they send these samples to the labs. And they if the sample like hMPV, there are two types of hMPV also, and there is hMPV A and hMPV. And I think it's hMPV B, which is quite prevalent. I'm not sure, I might be wrong here. So they also do the genetic sequencing of this. Uh, the need for going to get tested for hMPV, it depends on the doctor's suggestion. If the doctors sees that okay, it can bring uh, uh, something valuable to the treatment, then they can suggest that okay, the genetic sequencing can be done and PCR test can be done. This is all dependent on the doctors here.
And the treatment for for this is the same as
Same
any
as
other
yes,
respiratory illness, right?
yes,
So it is the same. It is a
yeah,
self-limiting. There is no vaccine for this.
yeah,
So this is another something which is concerning if it mutates. Right now, nothing to worry
nothing.
about.
Uh, Only one
Yes.
thing I want to add more, that we have to be careful. We have to be careful about the situation when we see these kind of news and cases around us. But more than that, we should also verify the sources. We should also look for multiple uh, angles as well. And sometimes what happens that when we just make some funny videos or memes out of it, it also cause a distress to many people. So we should be bit careful about providing the information and careful what we are telling to the people.
True, true. So I think we are more or less done with it. But one thing which I really, gathered from a lot of experts and also doctors and also from my past experience of COVID-19, what we should probably follow is the respiratory hygiene,
Yes.
which means we need to wash our hands. We should not touch our face, nose, and better to follow all these, the whatever we have been taught through the COVID days. I think we should just remember those and follow the respiratory hygiene. And children, if somebody is really unwell, then it is better not to send them to school, just because if it even if it is a viral infection, it can uh, transmit from one child to another child. And if you have immunocompromised people at home, and if there is anybody elderly at home, then it is always better to stay safe and ensure that you whoever is stepping out, follow all the respiratory hygiene instructions very, very carefully. And whenever there is symptoms of cold, cough, and fever, do not take any antibiotic on your own. Please visit the
Yeah.
doctor, and only on prescriptions take medications. And one last thing which I would probably say is, Sumit, continue doing your reporting, responsible reporting that we have been doing at South First, and kindly follow and subscribe South First to get more information on not just hMPV, but a lot of other interesting health stories and political stories and ground reports. I think we are doing the great. Sumit, continue doing good work. Anything else to add to this?
Yes, please subscribe to our YouTube channel and also subscribe to our newsletter on website. And not only us, but our colleagues are doing quite hard work bringing policy, federalism issues, and also doing a lot of groundwork on various subjects and topics, and also bringing the voices from the ground. Please subscribe on YouTube as well as our newsletter. Thank you.
Thank you. Thank you for watching. Bye, Sumit. Good day.
Bye.
Waiting for your reports.
See you.